today, I have directed AHS to rescind its immunization of workers for COVID-19 policy effective March 10th at 4 p.m. This directive covers employees of AHS, its subsidiaries and Covenant Health employees, members of the medical and midwifery staff, students and instructors, volunteers, and applicable contracted service providers, including those working on AHS sites and separate providers under contract. This change is in line with policies in other jurisdictions, including Manitoba and Quebec. As of 4 p.m. tomorrow, AHS will no longer require currently unvaccinated employees to do mandatory rapid testing. Employees on a leave of absence due to immunization status should work with their managers to determine their return date. I know that a draft copy of this directive was leaked last week. However, I want to reiterate that the current directive signed off and released today with an effective date of March 10th at 4 p.m. is what will be implemented. When this immunization policy was implemented late last year, it was to protect patients, healthcare workers, and the public during a time of record transmission and an incredibly severe wave of Delta. And at that time, we committed to reviewing the policy by March 31st, 2022. Fortunately, now, we are at the tail end of the Omicron wave, and with our high vaccination rates, we're in a very different situation. We're extremely grateful to all those workers who chose to get immunized. This was essential over the last year to protect themselves, their patients, and our healthcare system. I know AHS continues to recommend COVID-19 immunization to all its staff and will continue to work with those who choose not to get immunized to address their concerns, answer their questions, and educate them about the importance of immunization and vaccine effectiveness. Outside of the health system, we continue to follow the evidence to make sure Albertans are protected by vaccines, including additional doses as necessary. That's why, following the recommendation of the Alberta Advisory Committee on Immunization, I'm pleased to announce that beginning March 14th, Alberta youth aged 12 to 17 who have had their second dose at least 5 months ago will be able to receive a third dose. I know this is welcome news for many parents, guardians, and youth. As you know, we are also in the middle of a 2-week effort at AHS clinics to get more children between the ages of 5 and 11 vaccinated. To make it easier for parents and guardians to get their kids immunized, clinics across the province are providing pediatric doses on a walk-in basis and extending clinic hours. In the first week, more than 6,500 first and second doses have been administered. This is great news for young Albertans, their families, and our communities. We'll continue to work to increase boosters in the general population and make pediatric vaccines available for families who choose to get them for their children.